as synthetic opioids like fentanyl continue to leave a devastating mark on communities throughout Missouri and the U.S. Officials and families in St. Joseph are digging in on their roles in fighting back against the ever-evolving crisis. News Press Now's Cameron Montemere brings us a special report on how the deadly drug is impacting the community and what lies ahead.
It took Angie Renee Botteroff nearly a year before she could overcome the emotion to drive by the gas station on South 22nd Street. The afternoon of June 13, 2022, was the last time Angie talked with her son before he overdosed on fentanyl. By that night, he was pronounced dead, one of 30 fentanyl-related overdose victims in Buchanan County and over 1,400 recorded in Missouri in 2022.
He was very personable and he was the comedian of the family. You know, he was just a bright light to everybody that was around him.
Micah, a 2010 Central High School graduate and avid motorcycle enthusiast, was just 16 years old when he began to use heroin. Struggles with his bipolar disorder and the divorce of his parents contributed to a spiral into drug abuse. Micah went out that June night looking to buy heroin. Instead, he was sold a narcotic 50 times more powerful than fentanyl. Micah was found unresponsive in the bathroom of the station shortly after he used. His condition was so bad that Narcan wasn't even strong enough to bring him back.
So I really feel like the fentanyl really robbed me of my son.
In the 27 years working with the Buchanan County Drug Strike Force, Captain Sean Cawley had never seen a drug as powerful as fentanyl before it appeared on their radar.
Not like this, because in the past, what we were seeing was, maybe an overdose, whether it was cocaine or meth, but typically it was in larger quantities being taken. We have not seen anything to this effect of such a small amount can kill a person.
Originally created in 1960 by Dr. Paul Janssen as an anesthetic, the pharmaceutical drug was used primarily for cardiac surgeries in late-stage cancer patients. But in the last 2 decades, the production and distribution of illicit fentanyl has skyrocketed.
I would say we're probably up to 80–90% of what we work is fentanyl related. And so, it's kind of scary when you start looking at that.
Last year in Buchanan County, 973 grams of fentanyl or fentanyl-laced products were seized. So far in 2023, over 5,000 grams have been confiscated by the Drug Strike Force, a 439% increase in just 1 year.
When you look at what we've done during the last year and the last several months, we're making a huge impact on what's coming into our community.
Now, keeping up on the cat and mouse game of fentanyl trafficking has become an ever-evolving process for local law enforcement. Central to the Drug Strike Force's fight against fentanyl is daily coordination with some of the highest law enforcement agencies in the United States.
For us, we literally have pretty much embedded with DEA. We have people assigned directly to DEA, the U.S. Marshals, ATF, and then we work daily with FBI, HSI.
But that's just one piece of the puzzle. The Drug Strike Force has ramped up its education and prevention efforts with the St. Joseph School District. The same can be said for their expanding partnership with local health organizations, allowing them to gain valuable insight into everything from fentanyl's impact on the body to what doctors and medical personnel are seeing with people impacted by it.
We saw a huge disconnect between the medical side of the workforce and the law enforcement side, and lack of communication. And we have an opioid task force through the health department that brings a lot of us together.
Within the walls of the St. Joseph School District's administration building on North 26th Street, Nursing Coordinator Elizabeth Chase and Health Services Coordinator Tammy Smith-Hinkie work closely to ensure the district focuses on positive coping mechanisms and mental health awareness from a young age in their fight against fentanyl and all substance abuse. They also see close coordination between school nurses and counselors as key to helping students recognize signs and symptoms to report.
And so if we have peers teaching their friends about positive coping mechanisms and how to stay away from substance abuse, I think that that's going to have a large effect on how they are making their choices.
Between the many partnerships with community organizations like Family Guidance and Youth Alliance to the Drug Strike Force and Police Department, Chase and Smith-Hinkie both agreed it's going to take everyone involved to make significant progress.
We have to partner together with our community partners and also our parents. That's really the only way that we're going to get through. It can't just be one person fighting the fight. We all need to join arms together.
Even in the face of overwhelming grief, helping families who have lost a loved one to fentanyl overdose is a priority for Micah's mission, a support group started by Botteroff in Micah's honor.
I felt like I couldn't save him from passing, but I really felt like I could be an advocate out there, that he didn't die in vain, and then I would be able to educate
Since Micah's death, Badarov hasn't given up hope that those responsible for supplying Micah with the fentanyl will be brought to justice. She harbors resentment toward local law enforcement for the way she feels her son's death was investigated. Captain Cawley said one of the biggest obstacles law enforcement encounters when investigating and potentially developing a case is a lack of solid evidence when law enforcement comes into contact with an overdose victim.
Unfortunately, within the culture of drug use and drug users, and understandably so, there's that distrust of the police or of law enforcement, and so we're not getting a lot of information at times, or a lot of information that we can use towards prosecution.
Reporting for News Press Now, I'm Cameron Montemare.